Welcome to the deep dive. Today, we're tackling something really important for our furry companions. Two conditions that can impact their eyesight: optic neuritis and papilledema.
Yeah, those names, they sound a bit technical, maybe a bit intimidating.
They do, but what they represent is crucial for understanding, potential vision problems in dogs and cats.
Absolutely.
So, our mission in this deep dive is really to cut through the medical jargon. We want to get to the heart of what these conditions are, what might cause them, and what the potential outcomes could be, so you're better informed.
Exactly. We've been looking at some detailed medical info on this. And while it can seem dense, the core ideas are actually quite fascinating
Yeah.
and really relevant for any pet owner.
Right.
We want to give you a clear picture, basically, what the terms mean, how these issues develop, the signs you might notice, and, what the possibilities are down the line.
Kind of understanding the basics of how it affects vision and their overall health.
Precisely. Their well-being.
Okay, let's dive right in then with the essentials. Defining optic neuritis and papilledema. In simple terms, what are we looking at here?
Okay, so optic neuritis is basically an inflammation of the optic nerve.
The nerve itself.
Yeah, the nerve itself, that's the superhighway carrying all the visual information from the eye straight to the brain.
Got it.
And if that highway gets inflamed, the signals get disrupted. That leads to reduced vision.
Makes sense.
And this can happen in just one eye, or sometimes both. It's like a traffic jam on that visual pathway.
A traffic jam, that's a good way to picture it. Okay. And papilledema, it sounds similar. It has that optic part too. Is it the same kind of problem?
It does sound similar, but there's a key difference. Papilledema is a swelling, specifically of the optic nerve head.
The head, where it connects.
Exactly, where the optic nerve plugs into the back of the eye. And what's interesting here, or maybe crucial, is that initially, this swelling doesn't directly mess with the nerve's job of sending signals.
Oh, okay.
So in the early stages, you might not see obvious vision changes.
Right, so optic neuritis, the nerve's inflamed, not working well, sight is affected directly. But papilledema is swelling. That doesn't immediately stop the signal. But, that swelling still sounds like a problem, a red flag.
Oh, absolutely, a big red flag.
Yeah.
And here's where it gets really interesting pathophysiology-wise.
Yeah.
Optic neuritis can start right in the optic nerve itself. That'd be a primary issue. But it can also be a sign of something else going on, maybe in the central nervous system, the CNS.
The brain and spinal cord.
Exactly. You see, the optic nerve, it actually has a connection to the fluid-filled space around the CNS, the subarachnoid space.
Ah, okay.
So an issue there, like inflammation, can sometimes ripple outwards and affect the optic nerve.
So the eye could be like a window.
Kind of, yeah. A window into the health of the brain and spinal cord, potentially.
And that's fascinating. So a seemingly isolated eye issue could actually signal something bigger systemically.
It could, yes.
What about papilledema then? What causes that specific swelling?
Papilledema happens when the pressure of the cerebrospinal fluid, the CSF, gets too high.
That's the fluid around the brain and spine.
That's the one. It cushions everything. But if the pressure increases, it essentially pushes on the back of the eye where the optic nerve connects.
And causes it to swell up.
Causes it to swell, exactly. Like putting too much air in a balloon eventually starts to bulge.
Okay, so different kinds of pressure causing different issues. Inflammation versus, physical pressure from fluid buildup. Can these two problems ever show up together?
Yes, they definitely can. You could have inflammation of the optic nerve that also leads to swelling.
So optic neuritis with papilledema.
Correct. Or, like we said, they can happen entirely on their own. It really depends on what's going on in the animal's body. It just highlights how complex these things can be.
Right. Okay, so what are the clues? For us, as pet owners, what signs might indicate our dog or cat could be dealing with either of these?
Well, for optic neuritis, one of the biggest signs, and often the most alarming, is sudden blindness.
Just suddenly can't...
Yeah, it can be quite dramatic. And because of that potential link to the central nervous system we talked about,
Right.
you might also see other neurological signs. Maybe they're wobbly when they walk, that's ataxia, or they could have seizures, or even just changes in their usual behavior.
So sudden blindness plus maybe acting strangely?
Exactly. That combination should definitely raise a red flag, prompt a vet visit for sure.
That sounds incredibly worrying. And what might a vet see during an exam if they suspect optic neuritis?
Well, during the examination, the vet will check several key reflexes. If optic neuritis is affecting vision, the animal might not blink when something like a hand moves quickly towards their eye.
That's a menace response.
That's the menace response, yes. And their pupils might not constrict properly in bright light. That's called the dazzle reflex.
Okay.
Sometimes if it's just one eye, the pupils might even be different sizes. That's anisocoria.
Unequal pupil.
Correct. Interestingly, the front part of the eye, the anterior segment, usually looks perfectly normal.
So the problem's hidden in the back.
It is. When the vet looks into the back of the eye, they might see the optic nerve head looking redder, maybe congested, swollen. Sometimes there are even little bleeds, hemorrhages.
Wow.
And there could be other signs too, like the retina around the optic nerve might be detached, or there could be inflammation deeper in the eye, like chorioretinitis. So while you might just see blindness at home, the vet is looking for these specific internal changes.
A lot of telltale signs for a vet to look for, definitely. Now, what about papilledema? You mentioned it doesn't initially cause vision loss. So what should owners or vets be looking for there?
Right. With papilledema, because vision isn't the first thing affected, owners might not notice specific eye problems right away.
Okay.
However, similar to optic neuritis, because it often stems from that increased pressure around the brain.
The high CSF pressure.
Exactly.
Yeah.
You might well see other neurological signs, maybe changes in behavior, lethargy, perhaps disorientation. Other signs of CNS dysfunction could be present.
So, again, looking at the whole picture, not just the eyes. And what would a vet find on examination in a papilledema case?
In papilledema, the changes are usually in both eyes, typically bilateral. And unlike in, say, advanced optic neuritis, those reflexes, the menace and dazzle, are usually normal.
Ah, okay, that's a key difference.
It is. And the pupils react to light normally. The front of the eye still looks normal.
So the action is all at the back again.
All at the back. The key finding is that swelling and elevation of the optic nerve head, there's normally a little dip in the center, the physiologic cup.
Right.
That might disappear, just looks kind of puffed up.
Yeah.
And importantly, the retina itself usually appears normal in pure papilledema.
So the big distinction on exam is those normal reflexes, despite the obvious swelling back there.
That's a major clue, yes.
Yeah.
Normal reflexes, swollen nerve head.
Okay, so normal reflexes, but a swollen optic nerve head, key indicator for papilledema. Now let's dig into the why. What are some of the underlying conditions? What actually causes optic neuritis and papilledema?
Okay, for optic neuritis, the list of potential causes is, well, it's quite broad. Yeah. What's interesting, especially in dogs, is that often we just don't find a specific cause. We call that idiopathic.
So unknown cause. That must be frustrating.
It can be, but there are known causes too. Things like systemic fungal infections, mycosis, certain viruses like canine distemper in dogs,
Okay.
or feline infectious peritonitis, FIP, in cats. Tumors are also on the list. They could start in the eye or, more commonly, spread from somewhere else.
Metastatic tumors.
Exactly. Then you have various infectious agents, toxoplasmosis, neospercaninum, inflammatory brain conditions like GME, that's granulomatous meningoencephalomyelitis.
Is that a mouthful?
It is. Tick-borne diseases like ehrlichiosis can do it. Even inflammation in the tissues around the eye, orbital cellulitis, parasitic diseases like hepatozoonosis, and even certain toxins like lead poisoning.
Wow, that's a huge range. It really highlights how many different things can potentially impact that nerve.
It really does. It's quite vulnerable.
What about the causes of papilledema? Is that list just as long?
It is quite varied as well. And what's striking is the overlap you see with the optic neuritis causes.
Oh, interesting.
It really emphasizes how interconnected these systems are, right? How a problem in one area can show up in different ways.
Makes sense.
So for papilledema, CNS tumors are a major concern because they can directly increase that intracranial pressure.
Right, taking up space.
Exactly. Liver problems that affect the brain, hepatic encephalopathy, can cause pressure changes. Fluid buildup in the brain, hydrocephalus, is another cause.
Okay.
And then we see some familiar names, distemper in dogs, FIP in cats, systemic fungal infections, toxoplasmosis, GME. They're all back on the list.
So infections and inflammation again.
Yes. And finally, physical head trauma can also cause increased pressure within the skull, leading to papilledema.
Gosh, so many overlaps. It really drives home that point. These eye issues can absolutely be a symptom of a much broader health problem.
Precisely. The eye exam can be critical for picking up clues about systemic or neurological disease.
So, if a vet suspects either optic neuritis or papilledema, how do they sort it all out? How do they figure out what's really going on and rule out other lookalikes?
Well, as we touched on, those normal pupillary reflexes and the lack of immediate vision loss are really key clues pointing towards papilledema, distinguishing it from optic neuritis. at least initially.
But there are other things that could cause blindness or weird eye signs.
Oh, absolutely. A thorough diagnostic process is crucial. For instance, you could have cortical blindness.
That's a brain issue, right? Not the eye.
Exactly. The eyes and nerves might be working fine, but the brain isn't processing the visual information correctly. In those cases, you often have normal pupillary reflexes, and the back of the eye, the fundus, looks normal.
Okay.
But you might see other neurological signs. And a special test called an electroretinogram, or ERG.
Like an EKG for the eye?
Kind of, yeah. It measures the electrical activity of the retina. In cortical blindness, the ERG would be normal because the retina itself is working fine.
Ah, okay. That helps differentiate. What about SARDS, that sudden blindness thing in dogs? Does that get confused sometimes?
It can. Sudden acquired retinal degeneration syndrome, SARDS, in dogs. Well, it causes sudden blindness, so it can look a bit like optic neuritis at first glance.
Right.
With SARDS, the pupillary light reflexes can be normal, or sometimes they're absent. And initially, the fundus, the back of the eye, might look pretty normal too.
So how do you tell them apart?
The ERG is the key. In SARDS, the ERG will be flat, completely flat. That tells you the problem is primarily with the retina itself. The photoreceptor cells aren't working. It's not the optic nerve in that case.
Okay, so the ERG is really vital for pinpointing if the issue is the retina, the optic nerve, or maybe further back in the brain.
Extremely important diagnostic tool in these cases, yes.
What other tools do vets use then to, get to the bottom of optic neuritis or papilledema?
Well, beyond the really thorough eye exam and neurological exam, standard blood work and urine tests are usually run. They help look for signs of underlying systemic disease, infection, inflammation.
General health check.
Pretty much. Then there are more specialized blood tests, looking for specific viruses or protozoa like toxoplasma or fungal infections.
Testing for those specific causes we listed earlier.
Exactly. Advanced imaging is often essential. Things like MRI or CT scans of the brain and the orbits, the eye sockets.
To see the structures directly.
Yes, to get a really good look at the optic nerves, the brain, check for tumors, inflammation, swelling, hydrocephalus, things like that.
Makes sense.
Analyzing the cerebrospinal fluid, the CSF, can also be incredibly valuable.
Taking a sample, a spinal tap.
Usually, yes. It can tell us a lot about inflammation or infection right within the central nervous system. And as we mentioned, if papilledema is suspected, actually measuring the CSF pressure can sometimes be done. It's really a multi-pronged approach.
Putting all the puzzle pieces together.
Trying to, yes.
That sounds like a very thorough investigation. Okay, so once a diagnosis, or at least a strong suspicion, is reached, what are the typical ways these conditions are treated? Let's start with optic neuritis.
Okay. For optic neuritis, the treatment really hinges on tackling the underlying cause, if we can find one.
Always treat the cause first.
Always. If it's an infection fungal, protozoal, then the priority is using the appropriate antifungal or antiparasitic drugs. Specific treatment for that bug.
Right, but what about those common cases in dogs where the cause is unknown, the idiopathic ones?
Good question. In those idiopathic cases, a standard approach often involves using corticosteroids, like prednisone, usually starting at fairly high doses to really knock down that inflammation.
Anti-inflammatories.
Strong ones, yes. The dosage is then typically tapered down gradually over several weeks or even months.
Okay. And how is papilledema usually managed? Is it similar?
The immediate goal with papilledema is different. It's all about quickly lowering their high intracranial pressure, the CSF pressure.
Right, relieve the pressure causing the swelling.
Exactly. Medications like mannitol, which is given intravenously or sometimes hypertonic saline, can help draw fluid out of the brain tissue and reduce the pressure fairly rapidly.
Emergency measures, almost.
They can be, yes. Corticosteroids might also be used to help reduce inflammation or swelling associated with the underlying cause, but there's a key exception. They are generally not used if the papilledema is due to head trauma.
Ah, okay. Important distinction. It sounds like these are serious conditions, usually needing pretty intensive medical care, right?
Absolutely. Hospitalization is often necessary, certainly for the diagnostic workup, and usually for the initial stages of treatment as well.
For monitoring and IVs?
Exactly. Close monitoring is key, and giving IV medications like mannitol. Supportive care is also crucial, particularly if there are significant neurological signs.
Yeah, what kind of support?
Well, just basic nursing care, making sure they're comfortable, keeping them clean, helping them turn if they can't move well, assisting with eating and drinking if needed, managing seizures if they occur, just supporting their basic needs while the primary treatment gets underway.
And what's important for owners to understand, if their pet gets diagnosed with optic neuritis, what do they need to know?
With optic neuritis, it's really important for owners to grasp that, unfortunately, vision loss can sometimes be permanent, especially in those idiopathic cases.
Even with treatment.
Even with prompt treatment, yes. Regaining full vision isn't guaranteed. Owners also need to be aware that treatment, especially with immunosuppressive drugs like prednisone, might need to be long-term, maybe even lifelong in some cases, to prevent flare-ups.
Wow, okay. That's a big commitment. Is surgery ever an option for either of these?
Surgery isn't typically a direct treatment for the optic neuritis inflammation or the papilledema swelling itself.
Okay.
However, if the underlying cause is something surgically treatable, like a specific type of brain tumor that can be removed, or maybe shunting for hydrocephalus, then surgery might be part of the overall plan to address the root cause.
Makes sense. Are there situations where certain treatments might be risky or maybe not recommended? Contraindications?
Yes, definitely. Using those immunosuppressants, like corticosteroids,
Yeah,
well, it can be risky if you haven't ruled out an underlying infection.
because it could make the infection worse.
Precisely. You could suppress the immune system's ability to fight it. So ideally, you want a diagnosis first. Also, with mannitol, the drug used to lower pressure,
Yeah.
we need to be sure the animal's kidneys are working and they can actually urinate properly, because that's how the excess fluid is removed.
Right. Need an exit route for the fluid.
Exactly. And like we said, corticosteroids are generally avoided in active head trauma cases. So yes, careful consideration of the individual situation is always needed.
A tailored approach, always best. Okay, what about follow-up? What can owners expect down the road, and what's the overall outlook for pets with these conditions?
Regular follow-up eye exams are absolutely essential.
To check progress.
Yes, to monitor how things are going. That includes looking at the fundus again, checking the appearance of the optic nerve, and of course, carefully reassessing vision at each visit.
How do you reassess vision accurately?
It involves observing their ability to navigate, checking those menace responses again, pupillary light reflexes, trying to get an objective sense. While seeing improvement in vision is obviously a great sign,
Yeah.
it's also important to remember that animals can be incredibly good at adapting to vision loss. They learn to compensate.
So an owner might think they're seeing better, but they've just gotten used to it.
It's possible.
Yeah.
So owner reports are valuable, but the objective exam findings are really key for tracking the disease itself.
Gotcha. Are there any ways to actually prevent these conditions from happening in the first place?
That's the tough part, because many of the underlying causes, infections, immune issues, tumors, are complex and not always preventable themselves.
Right.
There aren't really specific preventative measures we can recommend directly for optic neuritis or papilledema, unfortunately.
Okay. What about potential complications? What are the big risks associated with these conditions?
With optic neuritis, the most significant risk, as we've mentioned, is permanent vision loss. That's the major concern for that condition,
And for papilledema.
for papilledema, because it signifies that increased pressure inside the skull. Well, the most feared complication is something called brain herniation.
That sounds really bad.
It is. It's where parts of the brain shift or get squeezed due to the high pressure, and that can be rapidly fatal. It's a neurological emergency.
Wow. Okay, so putting it all together then, what's the long-term prognosis, the outlook for pets diagnosed with these issues?
It varies. For optic neuritis, the prognosis specifically for regaining vision is generally considered guarded to poor.
Meaning not great odds for seeing again?
Often, yes. However, for those idiopathic cases in dogs, if they respond well to the initial treatment, the prognosis for the animal's overall life can actually be quite good, provided they manage any long-term medication needs.
Okay, so they might be blind, but otherwise, okay.
That can be the outcome, yes.
Hmm.
For papilledema, though, the prognosis for life is often more guarded to poor.
Because of the underlying cause.
Exactly, because the papilledema itself is usually a sign of a significant, often serious underlying issue affecting the brain or central nervous system. The outlook depends heavily on what that underlying issue is and if it can be treated.
Right, that makes sense. So to sort of recap our deep dive today, we've learned that optic neuritis is inflammation of the optic nerve. It directly hits vision, and it can be linked to all sorts of things, unknown causes, infections, inflammation elsewhere.
Right. And papilledema is swelling at the optic nerve head, caused by that increased fluid pressure around the brain. It doesn't immediately zap vision, but it's a serious warning sign about potential CNS problems.
And for both, getting a careful diagnosis to figure out the why is absolutely critical for guiding treatment.
Couldn't have said it better. Understanding these key differences how they might show up, what could be behind them, the potential outcomes, it really can empower you as a pet owner to be more informed and proactive when you talk to your vet.
Absolutely. Better conversations, better care.
That's the goal.
And on that note, here's maybe something to ponder. We've seen how these conditions really highlight that intricate connection between the eyes and the nervous system. It makes you wonder, doesn't it? What other, maybe seemingly unrelated symptoms in our pets could actually be subtle clues pointing towards deeper health concerns?
That's a great point. It really underscores the complexity of veterinary diagnosis.
And the importance of that comprehensive, thoughtful care, looking at the whole animal. Well, thanks for taking this deep dive with us today.